Welcome to today's briefing on Alzheimer's, the second leading cause of death in California, as you will hear from our speakers. This is the second of 3 briefings EMS is doing in partnership with the California Department of Healthcare's Take on Alzheimer's campaign. The first such campaign in the country aimed at raising public awareness about Alzheimer's and encouraging early detection so that Alzheimer's patients and their families and caregivers can lead healthier lives. Our first briefing explored how to overcome the stigma around Alzheimer's. Today, we look at the disproportionate impact Alzheimer's has on women, both as patients and as caregivers. Our third briefing will look at how Alzheimer's patients and their families access care in remote parts of the states. 2/3 of Alzheimer's patients are women, and over 60% of caregivers are also women. Our speakers today will discuss how Alzheimer's hits women the hardest and what can be done to ease this burden, but also make it a caregiving opportunity to really, I think, expand the love and care we extend to one another. Our speakers for today's briefing are Dr. Winalina Canio, Chief of Geriatrics at Kaiser Permanente in San Rafael and Petaluma, Regional Dementia Care Clinical Lead at Northern California Kaiser Permanente. Dr. Mirella Diaz-Santos, UCLA Assistant Professor in Residence of Neurology and the Director of Equity for the Latino Healthy Aging Lab at UCLA. Annie Chung, President and CEO of Self-Help for the Elderly, who has coordinated caregiving for Alzheimer's patients for many years, and Mariana Ikanaveri, Fijian caregiver and founder in 2004 of Prestige Care in Marin and Sonoma counties. Today's briefing is interpreted in Spanish, Mandarin, and Korean. We will send a recording of the session to all participants this afternoon. If you have questions for the speakers, please enter them in the chat, and we will take as many as time allows. We encourage our speakers to also monitor the chat and respond as you feel you have relevant information. So let's begin. Our first speaker, Dr. Winalina Canio, will talk about why she was drawn to become a geriatrician working on Alzheimer's, why Governor Newsom's commission, of which she was a member, recommended the statewide Take on Alzheimer's campaign, and the challenges she sees and lessons she's learned from her daily work caring for Alzheimer's patients. Dr. Canio, please take the wheel.
All right, well, thank you so much, Sandy. Good morning, everyone, and thank you for joining us today to learn more about this critical effort. On behalf of the members of the California Governor's Task Force on Alzheimer's Prevention and Preparedness, it is my sincere pleasure to welcome you to this Take on Alzheimer's Awareness campaign. I will first address Sandy's question about why I was drawn to become a geriatrician working on Alzheimer's. I often accompanied my grandparents to their doctor's clinic visit as a child. I was really fascinated with the doctor's knowledge and ability to heal my grandparents both emotionally and physically. My grandparents had a significant role in raising me, and I wanted to be able to help them when I grew older. Unfortunately, my grandfather died when I was in middle school. My grandma had multiple strokes and was diagnosed with dementia, a mixed type, when I was in college. I volunteered at various nursing homes and hospitals in the Bay Area growing up. I felt a deep sense of fulfillment in helping the older patients. And unlike most kids my age at that time, I enjoyed listening to their life stories. As a medical student, I lived the challenge of managing older adults' complicated medical and psychiatric problems. And this led me uh, to seek a combined internal medicine and psychiatry residency program at the University of Kansas Medical Center before my geriatrics training at UCLA. As for focusing on Alzheimer's, I don't think I really made this decision until later. When I was interviewing for jobs, somehow I was being offered jobs in dementia care because of my unique background in both medicine and psychiatry. Although diagnosed with dementia, my grandma lived a relatively longer life, dying at age 95. She and I have been happy that I could help her with her geriatric healthcare needs in the last decade of her life. To me, that was a dream come true. In the early years of my medical training, my grandmother's symptoms were not as challenging. So we didn't really ask for help or um, go to caregiver resource centers or anything like that. But I soon realized that the knowledge and skills I learned during training helped me cope with the symptoms she had in the later stages of dementia. So the experience I had caring for my grandmother and thousands of people living with dementia in Marin and Sonoma helped me realize the gift I had to focus on this special population who are unable to speak for themselves. And so now I will address your next question. Why is Governor Newsom's task force recommended the statewide Take on Alzheimer's campaign to address the challenges I see and lesson I've learned from my daily work caring for people with dementia? You probably all know that in 2019, Governor Newsom announced the creation of the groundbreaking task force responsible for submitting recommendations on how California can prevent and prepare for the increase in cases of Alzheimer's and other diseases causing dementia. And I was fortunate to have been one of the appointed members. As I've shared, so these numbers represent real people, real caregivers, and real stories that I witness daily as a geriatrician and a psychiatrist. As I've shared earlier, my grandmother was diagnosed with dementia. She started mixing up the story she had told me growing up. Her doctor gave her a medicine and told her it may or may not help. So over the years as a family, we suffered ambiguous loss as grandma was losing her ability to cook, move independently, shower on her own, control her bladder, and other losses. As caregivers, we took turns helping her with these increasing disabilities while learning how to communicate in her disease stage appropriate language. And one day, as I was helping her with bathing, she cried and said, "Why are you helping me with this? I bathe you." I responded, "You're right, you did. So now it's my turn." When my grandma's paid caregiver moved, my mom decided to retire early to take care of her at home. As emotionally and physically draining as it has been, mom often said, "I'll die before her." I give mom a break and I'll take grandma to spend 1 week at a time with us here in Petaluma. And this was the journey, an added unexpected career none of us expected, like every caregiver that comes to my office daily. So never before has this issue been more important. Not only does California have more individuals with dementia, with numbers expected to double by 2040, but this population is becoming more diverse. As we see in the story, these demographic trends create an urgency to prepare for and respond to the needs of all individuals with dementia and their care partners. So the final report of the task force included 10 major recommendations that were included within the master plan for aging. And together, the momentum created a movement to change the course of aging in our great state of California. And we have seen so much progress in the last 4 years. One of these 10 recommendations from the task force is creating an Alzheimer's disease public awareness campaign that is multilingual, multicultural, and intergenerational. The primary risk factor for Alzheimer's is age, and California is home to more adults age 65 and older than any other state, highlighting the need for awareness, education, and preparation. The Take on Alzheimer's campaign is the first ever statewide Alzheimer's disease campaign. It was developed by the California Department of Public Health to shift public perception and reduce stigma surrounding Alzheimer's disease. So since May is a meaningful month for women, not only is Mother's Day around the corner, don't forget, but next week is also National Women's Health Week. We're having this session to discuss the impact of dementia on women, particularly of color. By educating Californians about the prevalence of Alzheimer's disease, providing easy, accessible informational resources, and inspiring conversation like this, we can build understanding around the relevant risk factors for women, reduce the negative impacts of stigma, and work towards the goal of supporting women and families improve their brain health. I wish we had something like this when my grandma was diagnosed. It would have prepared us better, especially my mother, who provided the direct care for her. Our experience is no different from most Americans. As Sandy shared earlier, almost 2/3 of Americans with Alzheimer's are women, and more than 60% of Alzheimer's and dementia caregivers are women. When it comes to Alzheimer's disease, women and communities of color are at a significantly higher risk. According to the 2024 Alzheimer's Disease Facts and Figures report by the Alzheimer's Association, the lifetime risk for Alzheimer's dementia at age 45 is approximately 1 in 5 for women and 1 in 10 for men. Tragically, fear and stigma often prevent many from seeking information, assistance, or a diagnosis until the disease has progressed, which is why it's so critical that we provide educating our communities about the prevalence of this disease. I'm sure many of us here today know of a woman in our lives, whether a friend, family members, or neighbor, who may be facing this challenging disease as either a patient or caregiver. It's important to recognize that we all have a role in taking on Alzheimer's. With your help, we can educate and empower all Californians to recognize the signs of Alzheimer's disease for themselves and others. Start a conversation with friends, loved ones, or healthcare provider. Learn ways to reduce and improve brain health before or after an Alzheimer's diagnosis. Together, we can take on Alzheimer's. Thank you, Sandy.
Thank you, Dr. Canio. Could you tell us how early detection actually can make a difference in the course of a patient with Alzheimer's well-being, quality of life? Why is early detection so important?
Early detection is important as it opens doors to understanding the options when it comes to important legal rights and healthcare benefits. A lot of folks who are undiagnosed sometimes don't do well at home, not being able to take their medications on time, not going to doctor's appointment, leading to their overall care the overall care is affected until the cause of the reason why they're not doing well is not detected. It's also important to note that there are other possible causes of cognitive changes. It doesn't have to be Alzheimer's. What if you came to the doctor and reported all the warning signs that you've been hearing from this public campaign, it might actually be something more treatable, or there might be some reversible causes that we can do something about. Also, the fact that this is a diagnosis that's so different from every single individual. I was sharing my grandmother's story. My other grandma also had dementia, but a totally different path where she had the psychiatric symptoms that made it really actually a lot more challenging than the grandma that I was sharing. And when you are familiar with these symptoms and prepared by obtaining some caregiver training classes and education and even counseling, and then be able to prepare for the future improves the quality of life, not just for the person with dementia, but also for the family members and other caregivers that's caring for that person.
Is there research, asks one of our reporters, Anjana Naragarajan, is there research on why more women get Alzheimer's than men? Or are there numbers more because women live longer?
That's a very good question. That's what we are hoping is to get more information on the current research that are happening. Yes, women are living longer, and since age is the highest risk factors, then women have tend to have the disease. The other things that they're looking at are obviously things like hormonal or things about people's social factors, whether it's at the educational level. For a few years ago, women did not obtain a higher educational level, and now that they're living longer, we're seeing the effects of that, and we know that the more we use our brain, the more we have that reserve when we get older.
And finally, question from Araceli Martinez about disparities in the impact of Alzheimer's on different ethnic groups. We know, for example, African Americans and Pacific Islanders, indigenous people, others have higher rates, and Latinos. Is there anything you can share with us about research or disaggregated data that help inform these approaches, healthcare approaches to disparities?
Again, all of these are all in the research phase, but some things we know are some social factors, education, dietary habits. It's really important to all of us to learn about how to keep our brain healthy. And that is exercising, having aerobic exercise, 30 minutes, 5 days a week, eating healthy. What's good for your heart is good for the brain, and sometimes that's hard for some folks, depending on their depending on their culture and how the food that's prepared for them. But I think more to come on that.
Right, great. There are questions. Please take a look at the chat. I'm sure you'll be able to address some of them, and then we'll have time for final question at the end. So our next speaker, thank you so much, is Dr. Mirella Diaz-Santos, who is a neurologist, assistant professor in residence of neurology at UCLA, and who directs the Equity for the Latino Healthy Aging Lab at UCLA. Thank you, Dr. Diaz-Santos, for sharing your expertise with us.
Thank you so much for everyone here having me. So, un placer. Buenos días a todos, a todas. So just as a clarification, I'm a neuropsychologist who is in the neurology department, right? So that means, yeah, so that means that I am a psychologist that loves the brain, and I specialize in bilingual English, Spanish, neuropsychological evaluations. So when we were talking about, Dr. Canio was mentioning the whole process of early detection or understanding the diagnosis, I am one of the providers that does that cognitive testing, that paper and pencil memory tests, and so forth that allows the interdisciplinary medical team to decipher, okay, what is the most appropriate or consistent diagnosis based on symptoms and impact on daily life activities. So I want to say thank you so much for the opportunity, and I'll be brief as well, because I love to engage with our communities, and I know that several of you already asked some questions. So I will just tell you a little bit about, or kind of like complement what Dr. Canio was mentioning. So why women more higher risk of Alzheimer's disease? And I think that one message that I wanted to convey is, it's not our fault, right? It's like that aspect of like, oh, blaming us for having higher risk. I want to make sure that that is not the case. So when we, as Dr. Canio was mentioning before, think about with Alzheimer's disease and other related dementia, think about a puzzle, right? We have many factors that can increase our risk through our lives, and other factors that will make our bodies and our brains stronger, so they will be more resilient, right? So one aspect of the puzzle, and why we're talking about puzzles, is because not until recently, financial resources and allocation of resources have been allocated to actually understand that main reason. Why is it? So if you go into the internet, as you just I did recently this morning, you will see the same message of Alzheimer's taking a toll on women dating back in 2014, right? But more recently, researchers are allocating resources to study this question. So that said, it means that we know a little bit and we need to expand it. And the reason, and one way that we do this is when all of us partner with each other and academic and researchers to be part of the research enterprise to understand the why Latino women are higher risk, why African American women are higher risk, why Pacific Islanders like AIP, PI communities, indigenous communities, right? Because we tend to, for a lot of reasons, not trust biomedical researchers, right? So that being said, think about as a puzzle that we always talk about genetics, right? But genetics, biology, and environment, which is exactly what Dr. Canio was mentioning. So research is uncovering that there's some genes associated with in women that increase longevity, right? So that's one part of the puzzle. The other part of the puzzle is brain pathology by biological sex. There's some research indicating that, and like there's some interaction between biology and the neuropathology, meaning those that pathology that kind of like the tau and beta amyloid, which is typically associated with Alzheimer's, right? That accumulates more in the brain of women, right? Like, why is it? That's a research question to ask. We also want to think about inflammation. Think about all the chronic stressors that we endure day in and day out throughout our lives, right? Environmental stressors, right? Workforce stressors, the nuances that come with gender roles and the role of women in family communities and infrastructures. Think about the role of trauma, right? Finally, researchers at the NIH level are putting money and understanding the role of chronic stress throughout our life, trauma, discrimination, racism, and how those factors impact different communities at different levels, at different depths, and how that actually also increases our risk of Alzheimer's. Dr. Canio mentioned hormones. If you haven't seen, Dr. Lisa Mosconi from Cornell University in New York just published the Menopause Brain, which is a book that's talking about hormones in the perimenopausal menopause phase that impacts brain functionality, right? So that being said, I'm trying to be mindful of the time. So that being said, I want to, I hope that you kind of like capture that we're just like bracing the surface of the why. Why are women at higher risk? And that's a global question. Then why is certain like different type of communities and communities at higher risk? So we're crossing the like kind of like surface, we're at the surface, but to answer these questions, we need all of us to be with community, to engage with researchers, to ask the specific question that will benefit us as communities to understand the why and then create better tailored treatments and like both at the lifestyle and both medication. So I'll just conclude with that.
Well, thank you so much. And one of the questions comes from Nancy Tran. Would complexity of life and the explosion of news cause more damage to our memories and brain functions? Women tend to get involved and are more detail-oriented than men, she asks.
I love it is true. It is true. We with our brains are amazing. No, like I am pro women. So and think about what we do as women in this environment. Like how many to-do lists do we have? When we're here, what do we think about? Okay, does like what about my family? What about the workforce, like workforce and so forth? And so it's like think about the regulation system that we have, which is connects our brain with our hormone system, with our body. So we're always on the run. So it's always trying to balance itself. So, and we endure a lot of different traumas through our life. And news, for example, sometimes will trigger us. And with that triggering, like we have the hormonal secretion of cortisol. If we have too much cortisol in our brain, that impacts our hippocampus, which is the main area that Alzheimer's disease attack, which is responsible for memory. So it's like it's the aspect of regulation, but living in a society that keeps giving us multiple fires for us to regulate. Sometimes it's hard. We have done it at the expense of our own body and brain.
In terms of day-to-day raising awareness, especially in the Latino community, what do you think is the most effective way of getting people to feel it's okay, not so fearful, able to go? I myself would be afraid of having a test to see what my cognitive functions are. I would rather just have a kind of slow loss of cognitive. I think most of us really are fearful of
Yes.
getting that diagnosis. What would your advice be for the campaign to lessen this fear, and especially among Latinos, since you do so much interaction with your patients?
Yeah, absolutely. And I'm always with Latino communities. Actually, last night was city of Montebello, with the mayor talking about mental health and brain health in the Latino communities. So I think that one aspect for this campaign is like, yes, let's raise awareness. And yes, let's be very kind of like candid with our conversations, right? There's a lot of stigma around it. And I know that was part of the first part of the campaign. And it's like for what I have seen in communities, and I'm a psychologist by training, is in the moment that you share your story, just like Dr. Canyo, I hope that I pronounce it. I know. Share, we all have a story. You know, we all have a story. I left I'm from Puerto Rico. I left my island and my family because I have my grandmother who passed away before the age of 65. And no one talked about it. No one knew nothing about it. There were no resources. And I saw this beautiful, independent women kind of deteriorate in front of my eyes as in high school and not knowing what was happening. What continues to happen in our communities is exactly that. We're suffering in silence because we are afraid that we will be labeled by like dementia, which is typically associated with you're going crazy. And no one wants to be labeled crazy. Of course, no one wants to. But what Dr. Canio mentioned is there's a lot of factors that can impact your memory, and it's not dementia. So dehydration is one key factor, right? So what if we take care, if we act quickly, we can reverse those causes and hopefully reduce our collective risk by having these conversations.
That's a wonderful segue from Dr. Canio to you. And now we're going to hear from two people who've been for years very intimately involved with helping caregivers take care of people with Alzheimer's. We start with Annie Chung, who for years has been the president and CEO of Self-Help for the Elderly. And Ms. Chung will talk about the impact of Alzheimer's on Chinese families, especially women, and why there needs to be more public conversation around the disease. Ms. Chung, thank you.
Thank you very much, Sandy, and good morning, everyone. So I've been the executive director or CEO of Self-Help since 1983. So over that 40 plus years, our agency really have seen the rise, right, of awareness, even among the monolingual community. But yet, the Alzheimer is treated exactly like what Dr. Diaz Santos said. Sometimes our family members and even our community members mistaken Alzheimer and dementia and call it mental illness, because that's exactly what the Chinese translation used to be for Alzheimer. If you break up, for those of you that actually speak the language, I see, some of the reporters here that are from the Chinese community, and used to they call 老人痴呆症, right? That's if you break up the word 痴呆, it means stupid and silly. It's just such a derogatory and a demeaning term that family members just stay away from it. They don't call their loved ones afflicted with Alzheimer because they don't want to be associated to have a family member that have mental illness. So I think, Dr. Santos, you are absolutely right. So that alone carried on for a long time. So when Self-Help for the Elderly started to really hear the stories from our seniors and their family members, especially who are taking care of a loved one who have dementia, they try to hide it. And by hiding it, that means that they're not coming out to get any help or any resources, or they don't want to learn about the Alzheimer and dementia and other disorders related to Alzheimer. And so the situation just get worse. So that's how, as Self-Help for the Elderly, we started in 1966. I became the director in the 80s. And we felt that we have to change, right, that narrative and that understanding of the dementia. So we went to do a lot of research with more medical and institutions over in the Far East, like Hong Kong, Taiwan, China. And finally, Self-Help for the Elderly say, no, we're not going to call it 老人痴呆症. We're not going to say Alzheimer is a silly and stupid disease. And we changed that translation to 弱智, meaning less smart. So it helps a family to understand how to take care of their loved ones without this shameful shame, this scare, really scared about being labeled, exactly as doctor said. So that's how we organically address the issues of Alzheimer. So taking care of an Alzheimer patient is a 24/7. It really, exactly like Dr. Daniel and all of you that have relatives and loved ones, or try to do your part as family members to take care of someone with dementia. And also, sometimes we found that family members don't know how to differentiate between Alzheimer diagnosed, but also the other disorders like loss of memory, cannot focus, lost the ability to judge and to reason, cannot keep attention. And some of them also totally, gradually lose any means of verbal communication. So they just get frustrated, right? They say, why are you doing this? I asked you not to do this, but why are you doing this? Because family members, both caregivers that are family members, as well as trained professional caregivers, sometimes, need to be attending some training to help them understand and provide more appropriate and better care. So Self-Help for the Elderly strategy is to organically grow services or expand services. So we opened the first Alzheimer daycare center back in 1996. So that's like 28 years ago. But before that, we have a case management unit that really provide direct services and counseling to both Alzheimer patients as well as the caregivers. And we felt that even with daycare and the case management support is not enough. So in the 19 about 20 years ago, we went for a HUD housing grant and build a 15-bed Alzheimer residential care, a 24-hour, 7 days residential care facility specifically to take care of patients with Alzheimer and dementia. And we found that that's really very much needed in the community, because San Francisco and the Bay Area are losing a lot of the 6-bed to mid-size, like 15-bed, under 30-bed RCFE homes. And what happened to the family members when they took care of their loved ones for a long time? Then they get burned out. And then they quickly then just look for a nursing home to place the elderly, and sometimes far away from home. And that cut off visiting and support. So we're working very hard to make sure that they are mid to small size RCFE facilities that are still here in the San Francisco and Bay Area. And that is also at an affordable rate. The market rate to take care of Alzheimer RCFE patients now runs about $10,000 to $12,000 a month. You've all heard of that horror story, right? So a lot of our seniors are relegated to, more substandard homes, but also far away homes. So we must strategize together as a community to address that. So providing ongoing training and supports, and all of you that do support services, right, for this population is very, very important. So Self-Help runs regular bi-weekly support groups for family members who are taking care of Alzheimer patients, because we run a daycare center. We run an Alzheimer daycare, and for the family members that needed ongoing training, as well as some kind of outlet, to talk about it, to ask for help, and then to find out about what community resources exist in the community to really help them, so they're not alone, taking care of their loved ones. It's very, very important. So once in a while, we will take the whole group of family caregivers to an outing, even just have dim sum, like tea or a lunch or a picnic, that take them out of their intensive caregiving responsibilities, would help revive their energy and their dedication. So without family members, we're going to see a lot more institutionalization or premature institutionalization. And our job really is to prevent that. So I know that we don't have a lot of time, but I think that the strategies is probably ongoing, because when we started in this field, there's about 4 million patients, Alzheimer patients, that are the official statistics. But now, Dr. Daniel, you or Sandy said that there's almost 7 million, right? 6.9 million patients who are suffering from Alzheimer's. So you see the growth, and so people get very, very scared. So I think that community-wide strategy would be to do more awareness building, to make sure people are not calling Alzheimer patients by a very derogatory term in whatever language that Alzheimer is being translated, and then make sure that we give a lot of supportive services to the family members as well as professionally trained caregivers who could come back for renewal classes, some, revitalization, learn how to use maybe AI, very quickly to help lower their anxiety or their kind of understand which patient need what kind of specific care, and you could tailor make. But very important is to build some community resources around providing respite care when the family need to take off 2 weeks but could not do it for 20 years because they couldn't leave, someone that alone. Provide respite care, provide alternative, kind of a, like in our care home, we're too small to afford to set aside beds for just to take in short-term patients. But I hope in time, our holistic approach to take care of Alzheimer patients will include a lot of these really solutions. So I'll kind of stop here, Sandy.
That's a terrific overview. Could you tell us one example
Yes.
that comes to mind of the impact Alzheimer's has on the women in Chinese families?
Absolutely. Somehow we've seen a lot of families taking care of Alzheimer patients, and it usually really are the daughters who have to quit their jobs in order to take care of their loved ones on a full-time basis. We've heard family members have to move from the East Coast, back to San Francisco because none of the siblings, particularly if they are not women, they're not willing to take on this 24/7 responsibility. So we have to make sure that there are resources, to help. So we provide sometimes our trained home health aides to take care, of families who have a little bit more means to support 24-hour care. But then we know that once you place a caregiver, it's not going to be enough. Just so you almost have to have 3 shifts of caregivers in order to take care of one family. But I know that once you able to do that, you really improve the quality of life, not just for the patient, but also for the family members. Now they could focus on, spending quality time instead of like Dr. Canio say that all the incontinent care, the bathing, the cooking, and then the feeding, the grooming, if you can have a professional caregiver, if you could afford it. But if you can't, then there are resources that could, maybe get you some care on the respite and short-term basis. Sometimes children are also overcompensate for parents with Alzheimer. What I mean is sometimes as children, we feel very guilty if we don't do all of the personal care ourselves. We felt that, we shouldn't be hiring outside people to take care of our parents and grandparents. But then you get burned out, So I think that you have to balance. Self-care is very, very important.
Thank you so much. And that leads us to our fourth speaker, Mariana Ikanaveri, who has run an agency she founded of primarily Fijian, Pacific Island caregivers in Marin County and Sonoma. Ms. Ikanaveri is joining us on a trip that she's on, and I'm very grateful to you for making the logistical effort to join our call. Thank you so much. Tell us, if you will, your view of what it is that makes Fijians and other people from the Pacific Islands such a valued part of the caregiving workforce in the Bay Area.
Thank you, Sandy, and fellow panels of speakers for another exciting opportunity to continue the discussion on caregiving issue faced by Pacific Islanders, in particular Fijian caregivers in California, and how my agency, Prestige in Home Care, is taking a proactive role in dissemination of critical information about this caregiving issue, and one of which is the subject of discussion today is Alzheimer's disease. I am Mariani Ikanivere, and I own and run Prestige in Home Care, a non-medical California registered caregiving agency based in Petaluma, and we're currently serving the Greater Marin and Sonoma counties. Professionally, I'm a trained nurse in California, but I have ventured into caregiving business 20 years ago with the primary aim of promoting Fijian as the best caregivers for your loved ones in California or anywhere in the US. As alluded into our last conversation in November, due to the multi-generational and communal way of living, Fijians are used to taking care of their elderly and loved ones since childhood. So caregiving is ingrained in their DNA. All they needed was the professional training and certification to enable them to work as caregivers here in California. Today's discussion give us the critical support, the critical opportunity to be part of a strong advocacy group to our Pacific Islanders and Fijian caregivers. Whilst approximately 90% of the Fijian in California are involved in caregiving, and for us at Prestige in Home Care, 65% of my caregivers look after clients with Alzheimer's. I have noted that in the past 4 years, a continuous increase in the number of clients with Alzheimer's, and I couldn't agree more with the California state's statistics on Alzheimer's that in 2020, 12% of adults of 65 years and over living in California suffer from Alzheimer's. That's approximately 720,000 people. The number is huge, and so is the increasing demand for care. Will our caregivers, go ahead.
Just restate the number because you said 1,000. I think you meant million. People with Alzheimer's.
I think that was the statistic that was taken in 2024, California Alzheimer's statistic.
Right. Let's please continue. I just interrupted you because I felt you were giving.
Okay. All right. I'm sorry if I.
No, it's fine. Keep going, please.
All right. Whilst our caregivers are trained to know and address the symptoms of Alzheimer's, they are continuously reminded to take a break, go on vacation, visit relatives, attend sport or church events, and just to have fun. This is to avoid stress, burned out, frustration, and depression as a result of long hours in the duty of care. I am glad that Fijians have great networking avenues and platforms to share issues of concerns in caregiving. We have many church groups that meet on a regular basis just for a bite or to talk about how we can help each other in dealing with caregiving issues and concerns. It's true, we enjoy the work, but I have noted that it also takes its toll on the caregiver. This is why we have shared statistics and best practices or workable solution to ensure all is well informed and take the necessary adjustment to how they deal with their clients. In a way, we advocate for regular exercise, mental preparedness in the form of professional training, and the do's and don'ts of dealing with Alzheimer's clients, or for any other illness for that matter. As we would know, Alzheimer's typically progresses slowly in 3 stages, early, middle, and late, sometimes referred to as mild, moderate, and severe in a medical context. Knowing this stage is critical, and it allows me to prep my caregiver and how to handle the clients. Each day brings new challenges as the caregivers cope with changing levels of ability and new patterns of behavior. It's therefore mandatory upon the caregiver to note and report these changes to family members and medical professionals, and more importantly, take the necessary do's and avoid the don'ts in handling clients with Alzheimer's. It would be remiss of me not to mention that some caregivers has been in this business for years and are at risk of cognitive decline as well. It is important that a caregiver's agency as a caregiver agency, we ensure that our caregivers are physically, emotionally, and mentally capable to handle clients with all sorts of ailments, including Alzheimer's. It is in this regard that we strive to provide each client the best possible care and ensure their loved ones continue to enjoy the qualities of our service. So I will stop there, and once again, I thank you for this opportunity, Sandy.
Thank you very much. And one of the questions is that Pacific Islanders have a twice as high risk as, I guess, the more studied group, white Americans, having Alzheimer's. How has Alzheimer's affected the Fijian and Pacific Island community from your perspective? What has the impact been of Alzheimer's and its among Fijians in California?
Yes, I think that is true. With the Alzheimer's among the Pacific Islanders, and basically for Fijian, for the Fijians, and I think that mostly we've seen it with our caregivers now, and sometimes I think because that we've been working with these people, we've been taking care of people who has Alzheimer's, and we've started seeing a lot of caregivers who started we see signs. We're starting to see signs of Alzheimer's with the caregivers. Sorry, I'm just on Zoom. And I'm so sorry.
No,
Just kind of just people. I'm just at the business center at the hotel. I just lost my train of thoughts.
And it turns out you were correct and I was in error. You had given a figure of 720,000 people aged 65 and older. And I just want to go back quickly to Dr. Canio. The best statistics you can give us, Dr. Canio, for people living with Alzheimer's in California, and the concern over this figure rising over the next 2 decades.
Can you repeat the question? Sorry.
Yes, just could you give us the statistics on people living with Alzheimer's in California and the dramatic rise anticipated, which partly fueled your commission's concern about having a special initiative around Take On Alzheimer's?
Yeah, thank you so much for repeating that question. So the numbers that Jessica had put on the chat is correct as far as the last numbers from the Alzheimer's figures. And this is expected to rise to double by 2040. And one thing to note as well is that there are a lot of people who go undiagnosed and untreated. And I'm not sure if that figure that we have there is just Alzheimer's, but there are so many other types of dementia out there that may not even be counted there as whether it's Lewy body dementia, Parkinson's dementia, because sometimes people could have Parkinson's and they could develop dementia, but they're not really monitoring for that. So I would say that we have a lot more than what is being reported. And which is why we have this public awareness campaign, so that we can let people know what the signs and symptoms are, so that they can get some help, so that they can plan for the future accordingly.
Thank you. I want to go now to all our speakers, and thank you, Ms. Canaveri, so much for that very important insight into the prominent role Fijian caregivers play in this field. The initiative, Take on Alzheimer's, is mainly hoping to raise awareness through public conversation. There are so many aspects that this conference has raised, from the need for more data, the need to encourage people to see doctors for early detection, the advantages that come from working with healthcare professionals on the quality of life of somebody with Alzheimer's, and of course, the extraordinary role caregivers need, including family members who often are very isolated and don't have the support they need. I guess what I would most like to ask each of you, what is the most important indicator that the public is hearing this, that there is growing awareness? And what is your deepest concern as you look forward to the rising population, especially of women, but of all people with Alzheimer's? So if you would, your best hope and your deepest concern. And I'm going to start with our last speaker to ask you for a very quick summary. All of you have been deeply involved in this field, so we will take away your thoughts, the biggest source of hope and your biggest concern about increasing awareness so that we can expand care. Ms. Ikanaberi.
Well, I believe that my deepest concern is that the growing number of Alzheimer's in our community. And I think the most important thing right now that we have to educate our people and trying to do more awareness among ourselves and from professionals. And I think with the Pacific Islanders, I think so much contributing is into our diet. And I believe that that will be one of the most important issues that it needs to brought up, and for people in our community to be aware of that maybe that is some of the contributing factor of Alzheimer's.
The diet.
Because with the diet, because I think
Right.
diabetes that does do a lot of damage into the brain, high blood pressure, and I think those are some of the
That's very
most
right, very, very helpful. Ms. Chung,
yes.
what is your best hope and what is your deepest concern? As I think Dr. Canio indicated in a preparatory conversation, as the demand for care grows, we're losing people from the healthcare profession and from the caregiving profession. What's your biggest source of optimism and your deepest concern?
I'll start with the concern. My deepest concern is the caregivers' age are also older females that are most of the time tasked with taking care, right, of the Alzheimer patients, both family members and patients. And my fear is we're not attracting enough younger professionals to join the home health aide or the CNA or the field that do take care, because the younger people are not attracted. And also, we have to elevate, right, the status of a caregiver so that it's not like pay the least, do the most work, do the most unpleasant work, and we ask them to take care of our loved ones, but we don't compensate them properly. So that's my biggest concern is, the age is getting older. I'm talking about the caregivers themselves, and
Right.
yeah,
That's
it's not
important.
balancing up. Yeah. And my hope is that with all of our advocacy and outreach and awareness building, that people will, family members as well as us, right, that have the likelihood, 50% of anyone over 80 could likely also have Alzheimer. And I feel that if they treat Alzheimer like a flu, you know, if people are sick with the flu, they take medication, they take flu shots. But why Alzheimer patients are isolated, as many of us say, and family members are not able to reach out. So if we open up the awareness and bring an Alzheimer down to just like diabetes and cancer and heart disease, so that people do a lot of preventive care, and then for family members to reach out for help and assistance and resources.
These are very important remarks. Please hang on for our last two speakers. Dr. Diaz-Santos, your thoughts about your biggest concern and your greatest hope.
I'll start with the greatest hope as something that I continue to witness every time that I'm with community, is that these awareness campaigns, utilizing and implementing it through different means like social media, radio, YouTube, are informing our communities, because right now they're asking very, very thoughtful questions every time that a speaker from Alzheimer's Association or Alzheimer's LA or anyone engaging them in a conversation. These very thoughtful and deep questions are coming up that move away from the typical, which is it Alzheimer's versus dementia? So they're asking very thoughtful questions, which is also evident in our chat during this briefing. So that gives me hope, a lot of hope, because that means that these initiatives, awareness initiatives, are working, right? My biggest concern is that the healthcare system might not be prepared. That's my biggest concern.
Okay. So with that, that's excellent. With that, we put that on you, Dr. Canio. What is your biggest concern and what is your greatest hope? You left the governor's commission in order to join the task force charged with implementing this take on Alzheimer's. So you're right in the thick of this.
Yeah, well, thank you, Dr. Diaz-Santos, for actually stating. So I'm going to go with the concern first. You're right. There's a significant shortage of healthcare providers and caregivers, especially since the pandemic. Most folks chose a different career path. You've been hearing from all of us, taking care of older adults, especially for people with dementia, is really challenging. But I actually find it, and I think for the panel here, we find it rewarding. So there is hope there. And to effectively address this shortage from health system, whether locally, nationally, or from the state level, the folks that have more training in this have been prioritizing in helping train and educate all clinicians and caregivers in older adult care, especially for dementia. Some of you might be familiar with the Dementia Care Aware campaign, which actually came from one of the recommendations from the task force, is that primary care physician should be able to have some tools to help screen for cognitive issues. And then the other hope that I could share, that there's been so much momentum from the state level as well with supporting caregivers. And I'll give you a few things such as the CalGROWS, the IHSS career pathway, that really help provide a workforce training and career pathways and programs in multiple languages. And there's another one called CALS Connect. We have been piloting community health workers. This is something new to provide dementia care management through the state's Aging Services Network. So there's a lot of I know it seems so grim, but there's so much movement in the last several years, despite the financial situations we have. I think people have been coming together to help us with tackling this crisis. Thank you so much.
Well, thank you. We're now 6 minutes over the hour, and I think we could go on for much longer because this is such an engrossing topic that affects all of us. I also want to pay tribute to each of our speakers who I think really share the powerful lesson of caring for people with Alzheimer's. And if I can use my own experience, I would say it is learning the meaning of the word care. Thank you so much for all of you for helping us think about and, as journalists, take on the challenge of contributing to this initiative to raise awareness and promote conversation so that there will be less fear, less stigma, more early detection, and more support for caregiving. Thank you so much. This conference is now adjourned.